Assalamu alaikum everyone. This is Dr. Rafia Shah, and I have made this video in order to help the people who are appearing in MCPS Family Dentistry exam because I get several calls, several messages from the students to help them for the exam. They need to know sometimes the exam pattern, then they need to know how to study, from where to study, what are the subjects included, is the eligibility criteria, how to enroll with CPSP. So keeping all these things in mind, I felt the need of a time like this video should be made and it should be placed on a media that could be easily, accessible to all the students. And moreover, I have prepared a book for past questions, which all solved past questions. Those are more than 300, and they are answered for each and every subject, which is actually present into the syllabus of CPSP. According to that syllabus and exam, such questions are made. So I hope that would also help you. I'm going to introduce my book in the end of this session. So begin with the name of Allah, the most merciful and the beneficent. A little about me. I'm a dental surgeon. I have done several other degrees, but beside that, I have done my MCPS Family Dentistry in 2021. So though the other degrees, like the foreign degrees, I have done MCPS, MFD and DIP-PCD. For that, I have made videos, and those are present on my this channel, YouTube channel. But this time I felt need that a group who always ask me about, or the people who always ask me about them CPS Family Dentistry exam, I shall make a video for them as well. So as I said, I have prepared a book. Not prepared in another way, you can say I have answered all the past questions and I've compiled the book for your ease, for to help you people with MCPS Family Dentistry exam. And that will be discussed later as we proceed ahead. So the main purpose of this presentation is to guide you with the process of enrolling, preparing, succeeding in MCPS Family Dentistry exam. So how to enroll yourself with MCPS Family Dentistry? First step is you have to visit the site of CPSP. You have to see by navigation, you have to reach to the section of MCPS Family Dentistry exam. Once you navigate it, you have to see from the list that what is the date for the exam, is the portal open for the exam or not. Once the portal is open, you just need to download an application. After fulfilling all the requirement for the application, you have to submit the application along with the fee. But before submitting the application, you should know whatever the criteria which is asked by CPSP, you are actually fulfilling that criteria. So most important documents they usually ask is your degree, your PMDC registration certificate, your house job certificate, your picture, and things like that. Actually, this exam is an experience-based exam. So CPSP asks you that after your graduation, like after your BDS, a year of house job, and best is that you should have a good experience post house job experience of at least 2 to 3 years. As this exam is, you can see the term MCPS Family Dentistry. Family Dentistry means it's actually not a single subject specialization exam. Rather, it has several other subjects which are included in it. And family dentistry means the patient can come to you with any problem, like with the problem related to endodontic, with the problem related to periodontology, with the problem related to surgery, so on and so forth. So that's why they want you that you should be eligible to understand all the situations or conditions of the patient. At least you can give symptomatic treatment to the patient before patient is referred to any specialist of the subject. So before applying, you shall know what is your eligibility criteria. Are you fitting into the eligibility criteria? And then you apply for the exam. So as I said, these are actually the requirements: your PMDC, your house job certificate, your experience, your BDS degree. These are mainly the requirements which are needed. But additionally, I would suggest that you should have a good academic standing. That doesn't mean that you should be a position holder, you should be a top 10 student, or you should be an award holder. No, you should have a good academic standing. That means that you should have a clear basic knowledge about each and every subject which is actually included into the syllabus. And we would be talking about what are the subjects required, or what are the subjects which are included in it. And second, the most important, your commitment. If you're committed with the exam, you would be doing it. Trust me, you would be doing it. But if you're partially with the exam, you are not well committed, you cannot, if you know, definitely there are several people who are usually practicing in the days and the evening, or maybe they're working in the morning and practicing their private practices in the evening. Such people, especially if they're committed with the exam, they shall appear into the exam. But if they think they cannot, spare time for the study, then I think it's a useless. Several times you would be giving attempts and you won't be able to qualify the exam. In the first instance, everybody thinks, okay, this is a experience-based exam and that's going to be easy, as I thought. Frankly, I thought the same way. It's an experience-based exam and that's going to be easier exam. But when I started to study for the exam, when I appeared in the exam was so difficult. Trust me, I'm not saying it was not doable. It was doable. But the thing is that the way I studied, I thought it was not sufficient. I had to study more. I had to add more. I had to have more knowledge. So this exam is not that simple as normally people feel, as I gave you my example, as I felt. So once you are done with the requirement, you are enrolled with the CPSP. The second quick requirement you are supposed to accomplish is quickly pay to CPSP for the workshops, because this is one of the eligibility criteria to sit in the exam. Once your registration is done, now quickly you shall pay amount for the workshop at once. I would not suggest you pay amount for one workshop at one time, for the next workshop at one time. It's better to pay all the amount for all the required workshops in one time, that you should be in the priority list of CPSP. Because as you know, CPSP has several other students, several other programs going on side by side. This is not MCPS Family Dentistry only being taken by CPSP, but they do take MCPS exams. They do take MCPS in other fields. They do take supervisory workshops. So that's why to get, enrolled with a workshop or to get chance of finishing workshop gets, very difficult when you are paying your fee very late, or when you are waiting, like I'll be paying one by one. I would suggest you, because the way I went, I'm telling you that way. Quickly, once you're enrolled, you just pay for BLS workshop, for computer internet workshop, and primary surgical skill. You have paid. Now this is the job of CPSP to call you. Frankly, they cannot call you quickly after your enrollment. It normally takes 1.5 to 2 years for these workshops to complete, because as they'll be getting the seats, as they will be getting the list, your name would be coming that way to them. So you cannot ask them to make you earlier, and you cannot ask them to stop and take you later. No, they will be calling you accordingly as they have seats provided. And frankly, they keep preferences at the top. They always see that who is at the priority list. For example, if somebody is going to appear for IMM exam of FCPS, they will prioritize that student before you. So this is my suggestion. Rest is up to you. What do you want? So now you are done with everything. Now what about the syllabus? What are the areas to cover in the syllabus and how to study? There are mostly subjects, like they give in the exam, they ask you from, even in the oral exam as well as in the written exam. They ask from preventive dentistry, they ask from restorative dentistry, pediatric dentistry, periodontology, prosthodontics, basic orthodontics, oral medicine, and diagnosis. And I missed maxillofacial surgery. They do ask you from all these subjects. Also, epidemiology is included. Some of the questions of epidemiology are also included, okay, which I have missed from the list as well. So to cover the syllabus, I'll request you, or I'll advise you, go and see the CPSP syllabus, which is provided once you're enrolled with the exam, they provide you with the syllabus. That would be actually appearing in your portal when you will be logging in, and you will find that. And my recommendation, that the book I have compiled for you, this book will inshallah help you all with the exam, because it has all the questions on all the subjects I have made, and subject wise these are compiled. So this is the book which I have made, and beside that if you want to know more knowledge, if you want to have a group discussion, if you want to have any of your query solved, you can join my group that is named with MCPS Family Dentistry, which I created at the time when I was appearing for the exam and I had no guide. And in that time, there were very less people, one or two people who have done MCPS Family Dentistry, and it was hard to search the people and get the guide from. And you can join this group not only like for the guidance, but sometimes you find a lot of people who are preparing for the exam. You can ask them to make the study group with you, and guys can help each other. So about my book, it has all past questions. I have tried my best to give you proper answer according to exam pattern. This will help you, to prepare each and every topic according to exam pattern, the way CPSP asks you to attempt the question. And I hope this will be a powerful tool for you to build a confidence and not master in a way, like I cannot say, but at least it will make you clear with all the questions, what is being asked, how to answer, or how to deal with the situation, what is the examiner asking. So it will at least add into your knowledge. For query and guidance, you can email me at rafia.shah@lumps.edu.pk. This is my contact number, which I normally give to the students. So you guys can ask me. I can, help you anytime you want. And I don't say like, I trust like helping each other makes the way. So now coming to my book, this is little about it. This is compiled according to exam pattern. I have added all the questions for all the subjects. You can see these are the subjects which I have included as required by CPSP. These are all subjects which are having their all past questions, as this is the subject of oral pathology in the beginning of the list. So this way, like I have answered the questions of oral pathology. I have write down all the essential topics which are normally being asked, and on each topic which is shown in the outline, each topic has questions. They are answered according to exam pattern. So this way, this book has a lot for you to help you on each and every subject. I've tried my best not to miss single question, but maybe there are some left. I'm not exactly sure, but I've tried my best to give you best out of my knowledge. And in the end of the subject, in the end of the book, I have kept some mock exams for you guys to prepare, like to attempt once you are done with my book. So I hope this would be helpful, inshallah ta'ala. And for the book, you can contact me on a given number. Of course, it is compiled and it is made. If anybody is interested in requesting the book, you can message me, and I'll be knowing you. I'll let you know how much to pay. And once I'll gather the request, then the book will be going for printing, and inshallah we'll be delivering it at your postal addresses. Thank you so much. And in case any query, any problem, you can ask me, and inshallah you will always find me answering. If not answering at earliest, but later even, you would be finding the reply from me, inshallah ta'ala. So take care. Allah Hafiz. Bye bye. Keep me in your prayers.